Good evening and welcome to the COVID-19 pandemic updates. I'm Kayode Okikiolu. First, the highlights. Children celebrate their day for the first time since the outbreak of COVID-19 with an advice to be mindful of protocols. First in Edo, now in Delta State, the UN pledges to join forces with Governor Okowa to subdue COVID-19. And in India, 20 people reportedly received different types of COVID-19 vaccines for first and second doses by mistake. Well, COVID-19 figures show that children are not at as much risk as adults in terms of infections and fatalities. But even at that, the pandemic has affected them in ways we may not fully understand. Last year, they had to stay away from school, friends, grandparents, playgrounds, and other activities that involve physical meetings. So there's a lot to celebrate on this Children's Day for them. Well, here at Lagos, Governor Babajide Sanwo-Olu celebrated with school children across the state in a truly remarkable way, dressed as a Boy Scout.
It's a familiar style of celebration at this year's Children's Day event in Lagos State, as the children are allowed to gather at the Police College in Ikeja. Things were different last year as the COVID-19 pandemic made this impossible, and the state government had to visit some students in their homes.
Welcome our dear Governor.
Governor Babajide Sanwo-Olu, dressed as a Boy Scout, is here with his team to celebrate with the children. The State Commissioner for Education highlights the need for this year's event to take place.
We know what happened during COVID. There was massive learning slide as children were forced to stay indoors. They had to live in an unusual way, and this led to a lot of emotional and even physical trauma and all sorts of abuses. And so it's really topical. I must let you know that we are working tirelessly under our amiable governor, Mr. Babajide Sanwo-Olu, to provide all that you need so that you optimize your potential.
Thank you very much. Thank you very much. Thank you very much. The motto is do it right, be the best.
Then a parade by different public schools.
Thank you very much, Mr. Juan. Government Senior College, Agidi. Move on, move on, move on, please. Government Senior College, Agidi. Girls Senior High School.
This year's event is perhaps a compensation by the state government after a year of disruption of academic and other activities by the COVID-19 pandemic, a global scourge that also shaped the theme for the 2021 International Children's Day, unites to reverse the impact of COVID-19 pandemic on children.
Well, happy Children's Day to all the children out there, both in age and at heart. Well, today may be Children's Day, truly, but COVID-19 clearly is no child's play. Globally, more COVID-19 cases have been reported this year than in the whole of 2020. So no country, especially Nigeria, should assume it is safe. In the past 5 months, Nigeria has recorded over 78,000 cases compared to the 87,000 reported in the whole of last year. But let's break this down further for you.
Last week, the National Social and Behavioral Change Hands campaign aimed at ensuring a collective action to prevent further spread of COVID-19 in Nigeria was launched. The Nigeria Center for Disease Control is reiterating the message, asking Nigerians to ensure that all hands are on deck to put an end to the ongoing pandemic in their communities. According to the NCDC, 48 new infections have been reported from 5 states and the FCT. Lagos has the highest figures with 22 new cases, followed by Rivers and Enugu State with 11 cases each. 2 cases were recorded in Kaduna, while Gombe and the FCT recorded 1 case each. The latest update includes 0 cases from Plateau, Nasarawa, Kano, Osun, Ogun, Oyo, Ondo, and Ekiti states. The new cases have raised the total number of confirmed cases in Nigeria to 166,146. One person has been discharged in the last 24 hours, increasing the number of recoveries to 156,529. There were no casualties since the last 24 hours, which leaves the fatality toll at 2,071. Over 1.9 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while 15,259 of those vaccinated with the first dose have now received their second dose. In the second phase of the exercise, Katsina State is taking the lead after vaccinating over 4,000 of its target population, followed by Nasarawa and River State. This is according to an update by the National Primary Healthcare Development Agency. The health authorities are advising Nigerians to check their vaccination cards for the date scheduled to receive their second dose for full protection against COVID-19. Globally, more than 168 million confirmed cases and over 3.4 million deaths have been reported from several countries.
The World Health Organization has commended the country on efforts to ensure effective and efficient rollout of the COVID-19 vaccine. Well, during a courtesy call on the governor of Delta State, Ifeanyi Okowa, at the government house in Asaba, the United Nations resident and humanitarian coordinator Edward Cullen also advised the people to take advantage of the current vaccination program across the country and continue to use the non-pharmaceutical options available to reduce the cases.
Max vaccination program in Delta State started early March 2021 after taking delivery of about 80,000 doses of the Oxford AstraZeneca COVID-19 vaccine from the federal government. The vaccination exercise, which is still in progress, began with health and other essential workers as well as government functionaries. According to the state health authorities, administration of the second jab will begin in the coming week. The United Nations resident and humanitarian coordinator, accompanied by the World Health Organization representatives, are here to strengthen the partnership for an effective fight against the virus.
To address the impact of COVID-19 pandemic and accelerate implementation of the Sustainable Development Goals.
Governor Kowas knows too well the effect of the virus on the economy.
It's been some very difficult time for us, but we'll continue to do the best that we can to continue to touch on the lives of our people and to create hope.
The World Health Organization commends Nigeria for its COVID-19 vaccination rollout, but warns that people should not lose their guard, especially in the wake of the third wave of the virus.
Today in Africa, Nigeria is among the countries that needs the most vaccine doses and provide an opportunity for other countries as well to learn. But having said that, we are still far from the target.
According to the NCDC, Delta State currently has 2,627 confirmed cases, 812 of them active, and about 70 COVID-19 related deaths recorded.
And now to Ekiti State, where more than 100 students of the College of Health Technology in Ijero-Ekiti have been hospitalized after their campus was fumigated to prevent COVID-19. A team that claimed to come from the Federal Fire Service had gone to fumigate the campus unannounced with examinations in progress, and this triggered adverse effects on the students, especially those with underlying health conditions. In reaction, some rampaging students set a bonfire at the entrance of the campus, destroying school property, forcing staff and students to run for safety. It took the intervention of police officers for the fumigation team to escape the campus after hiding from the attack of the Irish students. The provost of the college was not available for comment, but the State Commissioner for Health visited those hospitalized and assures that the fumigation team will be brought to book if found guilty. Well, a lot of questions to answer on this one. We have joining us on the program Dr. Jimlas Ogunshaki, who is the Senior Special Assistant to the Governor in Public Health and Lead Compliance Officer at Ekiti State COVID-19 Task Force. Thank you for joining us, Dr. Ogunshaki. First, the obvious. Why did this fumigation take place while students were fully in session?
Thank you very much. And well, when we got the news that the school was in, they were rioting and all of that because of the fumigation that went bad, we were also a bit taken aback because when it comes to fumigation that is secondary to COVID, we have a protocol that we follow as a state. We have a guideline that has been set in place. The Ministry of Environment is responsible for fumigation. Other schools within the state, like the universities and other polytechnics, they actually go through the Ministry of Environment to get accredited for whoever is fumigating for them, or ask the Ministry of Environment to fumigate for them. So, but when we heard that, we were really taken aback because the Ministry of Environment was not aware that such fumigation was happening in the school.
So, yeah. So who then sanctioned or authorized this fumigation?
Well, I cannot say of a fact at the moment. I'm sure that His Excellency is setting up a kind of a panel of inquiry to look into that, and probably ask the management to kind of explain how that came about. Because usually, if it is COVID-19 fumigation, we usually do that before students even come on campus. And if they're on campus, we ask them to go home for like a week, and then the fumigation happens and everything is settled before they are asked to come back. So when we heard that, we were really taken aback because we really didn't know how that happened.
Well, clearly the students didn't get a chance to leave the school, and over 100 of them have been hospitalized or hospitalized as a result. What can you tell us about their health status at this time?
Well, quite some numbers have been flying around about the numbers of people that have been hospitalized. As of the last count, some people were admitted at the Federal Teaching Hospital in Ekiti, and some were also admitted at the General Hospital in Ijero, Ekiti. As at the last count, we had like about 24 people on admission, and nobody died, and all of them are stable at the moment. So
you're saying that in all, how many students were hospitalized? How many have been discharged? You say about over 20 are still on admission, but how many were hospitalized in total? How many have been discharged?
Okay, so maybe I don't have the recent data as of now, but as of early hours of this morning, we had like about 20 students on admission in the Federal Teaching Hospital in Ekiti, and of course at the Ijero, General Hospital at Ijero, I think like about 4 or so. But recent update at this moment, I'm not able to speak to that.
I mean, we don't look forward to this happening again. You've spoken about certain investigations ongoing, but what are the possible punishments, punitive measures that will be taken to ensure that this does not happen again?
Well, I'm sure that, as I said earlier on, that when the state sets up a panel of inquiry to look into what has happened, and the facts are on the table, I'm sure that His Excellency the Governor will take appropriate action, and whosoever might have contravened any of the regulations and everything that is on ground will have some explanation to do to that.
Well, Dr. Jimlas Ogunshakin will definitely be following up on this to find out what comes out of it. But I would like to thank you so much for giving some insights into what played out at this school. Thank you for your time.
Thank you.
Let's turn our attention to Adamawa State, where people are receiving their second jabs at various vaccination centers in Yola, the state capital, following the announcement by the Primary Healthcare Development Agency. Well, the agency says that those who received their first dose 6 weeks ago are to present their vaccination cards, as only those with the cards will receive their second dose.
In Adamawa State, over 37,000 persons across the 106 centers were injected with the Oxford AstraZeneca COVID-19 vaccines in the first phase. While the state awaits the allocation of more vaccines, it's going ahead to administer second doses to those who got the first. To flag up the administration of the second dose, Governor Umaru Fintiri, his deputy Crowther Seth, and other state officials at the Yola Specialist Hospital. The card shows a fully vaccinated status.
I'm happy, I'm fulfilled that I'm one of those Nigerians that have been immunized against the pandemic. And I urge on all our students in Adamawa State and Nigeria in general that we should go for this vaccine, which is safe and is the surest way against this pandemic.
Religious leaders who also get the job encourage residents to be fully vaccinated.
I would like to advise all Adamawa indigenes and any other person living in Adamawa State to come and take his own. These drugs, according to experts, so far there is no problem. So we recommend it for every citizen of this country.
Since the experts have already told us that the vaccine will be the best for us in terms of controlling this virus. So everybody that has the opportunity should please go out and take the vaccine.
Those qualified are expected to take advantage of the opportunity provided to increase their protection against the COVID-19 pandemic. They are also asked to continue with the safety measures put in place.
Well, let's head outside Nigeria, where the UAE government has announced public events will only be open to COVID-vaccinated persons from June the 6th. But for now, in the tourist city of Dubai, restrictions on live entertainment and weddings have been lifted temporarily. Now, this might not mean much to you if you're not in the entertainment or tourism sector, but for the industry practitioners who have not worked since January, one can only imagine what they've had to go through and what this means to them. But you know what? Let's not just imagine this. Let's hear from someone living the experience. Cathy Gold is a singer in Dubai, and she joins us live on the program this evening. Well, Cathy, great to have you on the program. January, February, March, April, and May, no show, and that's literally speaking. But first, what does this temporary lifting and plans for further easing mean to you?
Yeah, actually, it means a lot to me because this is about 5 months now we've not performed, and it has really affected us financially. And it's going to really mean a lot to us because we have to pay our bills. It's not been easy, not performing and not having money to take care of your basic needs. It's been a very, very hard one, but I'm very optimistic that, yeah, we're going to go back on stage.
You know, there was a lot of talk about virtual being the new normal. I mean, we didn't have physical meetings, but we moved virtual. I know you have done some virtual performances as a singer. Is it as rewarding as what you had before, physical events and the rest? Was virtual really the thing for you?
I didn't really get some virtual events. I didn't get, my band did not get any virtual events. We didn't get any virtual events. It was just total lockdown.
Okay.
And for the musician, for the music industry, it was not really, we didn't have anything to do because it was a very, very strong restriction that we should, the entertainment should be banned because of the increase of COVID-19. So we had to stay back, not until on the, was it on last week, Monday, they lifted the ban. Or they made a serious condition that everyone have to be vaccinated before we can go on stage. Yes, some musicians are actually performing because they took their vaccination maybe some couple of months ago.
You know, I saw some videos that you put out with your band. I mean, just to show content that you're working during the lockdown. But let's maybe look ahead now. Who knows when this will end? With COVID-19, you always expect the unexpected, so to speak. So is there any way to maybe shield yourself and others in your sector from being hit badly by something similar in the future? Is there anything like that?
Right now, I don't know. I'm just, we are actually optimistic that as soon as we take the vaccine, everything will go back to normal. That is our hope. And we don't pray to experience this kind of thing because it actually took us back and a lot of plans went wrong, you know. It was not really possible for us to achieve some of our plans. Last year, it was like 8 months lockdown. We didn't do anything. Everything was locked until November. Was it November? Yeah, November last year before we started working. And we didn't really work fully until January. They came that we should, the all entertainment should go on hold. So what we basically doing, we just call ourselves together, me and my crew. We just did some couple of songs at home just to keep the spirit alive, you know, and not to be down. So we use the music to encourage ourselves.
You know, Kathy, you tempted me and apparently it's worked. I wonder what song you want to perform when this is all over, really. Can you give us a snippet of it?
Yeah, you said you want, which song do you want me to do?
Whichever song comes, really, because I imagine the joy you feel. What song captures that?
The song that has always been keeping me going, and I will always want to perform it. It's a song titled "Rise Up." It's a very encouraging song. Like it's so encouraging, and the song is performed by one beautiful artist, an American artist.
Kathy, you need to give us something, even if it's a line or 2 lines from that song, if you don't mind.
Okay, let me see. I'll rise up, I'll rise like a day, I'll rise up, in spite of the ache, I'll rise up, and I'll do it 1,000 times again. Said I'll rise up, I'll rise like a day, I'll rise up, in spite of the ache, I'll rise up, and I'll do it 1,000 times again.
Well, I bet a lot of people... Oh. Well, Kathy, I'm sure a lot of people love to see you perform live, but this has been a beautiful experience. Thank you so much, Kathy, and we wish you the very best, really.
Thank you very much for having me. Thank you.
Whew, that was beautiful. Now, this next story is something I personally feared. In India, there are reports that 20 people have been given 2 different coronavirus jabs for their first and second doses by mistake. Well, officials say they were given a shot of AstraZeneca in early April, but then they got the locally developed Covaxin as part of their second dose in May.
The interesting thing about the story is that India has not allowed the mixing of vaccines, and studies going on around the world to see if different doses can be safely administered. But the government says that 20 people who received the mixed vaccines are healthy and have no side effects. And as COVID-19 cases continue to rise, people are flooding vaccine centers to receive the jab. The world's second most populous country this month recorded its highest monthly COVID-19 death toll since the pandemic started last year, accounting for just over a third of the overall total. France says its economy is on a strong recovery path, but most remain cautious. The comment was made by the finance minister, who has kept forecasts for 5% GDP. He says France will face a public deficit of over 9% this year, and that he counts on a strong growth to reduce the deficit quickly in the coming days. France began reopening last week following another COVID-19 lockdown.
But whatever you do, don't forget to protect yourself. The virus is still out there, so continue to take responsibility and visit our websites, channelstv.com, for more updates and a better understanding of the pandemic. We also have all the big stories for you, from politics to business, sports, and so much more, all at your fingertips. Well, in Kathy's words, we'll rise up. Well, that's COVID-19 update. Thank you for watching. I'm Kado Kikyole.